one of the things that we do in our office that's really good, and I think it really sets us apart from other dentists, is when you come to our office, we don't dictate treatment to you. Like we say, ma'am, you've got this missing tooth here. You need X, right? It's gonna cost you X amount of money. The way we do it in our office, and I've trained my team to do it because I think it's showing respect for our patients. We say, ma'am, you've got this situation. This is what it is. We have option A, B, and C, okay? Option A, unless you're dying or you're like, have pain, dentistry, let's face it, is optional, right? So option 1 is always leave it alone, right? Option 2 is we can do, let's say you're missing a tooth. We can do a bridge. It costs this much, it's a little bit less. And then you have the medically correct option, which is what I would recommend. But whichever option you choose, we respect. And I think that I've had so many patients come from other dentists who like transferred because they got pissed off or something. And they came over and they're like, well, they were trying to sell me something. And you know what? I don't think dentists in general try to sell anything. I mean, maybe there's some, but we're never trained to explain things right. We speak dentalese and patients speak English. All it takes is for you to slow down as a dentist, right? You slow down, you outline the options to the patient in plain English, and I'm telling you, like 99% of the time, they choose what's the best for themselves. Because if I were to ask somebody, do you want the best for yourself or do you want the second best for yourself? Like, not many people go, nah, you know what? I don't really like myself that much. I'm just gonna choose the worst option. No one says that. Everyone wants the best for themselves. What gets in the way of that is just our language, is the way that dentists talk to patients. So I think one of the things that sets us aside at Rios Dentistry is the way we talk to our patients and the options that we give them and the respect that we give their final decision. And the money side of it is that rolls with that because every option has a different price tag, right? So we offer nothing costs nothing. So you know what? You could walk out of our office with nothing done, and you're still part of our family. We don't judge that. Then we'll give you the quick and cheap option, in case you want to get something done, but you don't have the money to spend on something very expensive. But I think if I don't present you with the best option, I'm doing you a disfavor. So I give you 3 options. Do nothing, it's free. Do something temporary, but doable and not too expensive. And then do the medically correct thing, which usually has the highest price tag, but sometimes the most medically correct thing is to do nothing. So it's really kind of coming down and outlining those options to patients in a way they understand. And then that makes them trust you. And when they trust you, that's all they want. That's all we want. We want to earn their trust, but you never earn trust by dictating, you need this, right? Because all the patient's thinking is like, no, you need a new boat, right? That's not, and I don't even like boats.